So it's critical. It's critical to be able to talk about getting adequate sleep.
Hey everyone, welcome back to another episode of Heal Your Gut, Save Your Brain. I'm Callie Nandi, and this is my husband, Dr. Partha Nandi, gastroenterologist.
It's always fun to be with you. It's awesome, you know?
Yeah, we feel really lucky. The kids are kind of tucked in, so we can get right in. Yeah, for a minute. We'll see if we can hear them in the background. But today we're talking about the state of dis-ease. Look, here we go. Come here for a sec. Do you want to ask me something? You can ask me. What is it? Oh, it's not a good choice.
Not a good choice, Bubble.
Okay, so as we were doing this health podcast, our 4-year-old just came up and asked for candy. Okay, so he's had a good, healthy breakfast.
He did. He was
negotiating.
Lunch.
He was negotiating.
He's like his mother. I had never negotiated.
He's a strong negotiator.
He's very good negotiator. Like his mom. I always lose, by the way.
So for us,
have you ever heard of the term happy wife, happy life?
That's right.
There is no analogous husband term. Notice that there is no happy husband. There's like nothing that flows after that. But anyway, I digress again.
But
Go ahead, tell me about what happens.
Wife and life.
Yeah, but nothing with husband. It's like happy husband does not exist.
I'm just kidding. I hope that's
just
not true.
Kidding.
But I guess it's a good way to start a conversation about choices with your kids.
Yeah. But it's tough though. So what'd you do?
It is tough. We have a house full of people helping us. So I gave in a little. I gave a few pieces and I said, you got to go swimming. You got to go outside.
But then we tell them, right? When we do that, we say, this is your allocation.
I said, yeah.
You know, your 80-20 rule. So then you can't have it for X amount of time. And
to be honest, I'm going to get rid of it altogether. You know, the grandparents bring it over.
I know, but we do tell them it's an X amount of time, so they know the next time not to ask that day or in 2 or 3 days. So it's still, you know, and you don't have to be demonic about it, but they realize, and they now tell them, oh yeah, I already had that today, so I won't do it.
Yeah, Sean especially will say, well, I had, you know, a piece of birthday cake yesterday. I won't have anything today.
Yeah, simple sugar, right? That's what we're trying to avoid. And we don't love simple sugars, and our 10 and 12 year olds know about simple sugars and artificial colors, and this one has all of it. Yeah. Artificial colors, simple sugars, processed in God knows what factory with whatever health concern. I'll tell you, it reminds. I saw Pete last week. Pete's a patient of mine that has lower abdominal pain, bloating. He's got brain fog. He goes has trouble concentrating, and I'm not saying Pete eats that, but you know, he does some interesting things. And I think that this episode of gut dis-ease, right? We're talking about gut dis-ease. I think it's really to talk about, you know, we don't want folks that are watching or listening to really suffer the same course as Pete. Because I think that even though, unfortunately, Pete has some ideas of what to do, he doesn't do it. So I think that's the idea. There's so many people that just say, well, this is how it is. And can you just do something? Can you do a procedure? Should I have a colonoscopy? And I said, well, you know, we've had one. I don't think it's that. So it's tough. I think that's why it's important.
I also think it's like there's not an immediate response. And that's what's tough too. It's not like we talk about this. You can't sleep, you take a pill, then you can sleep. Versus this is a process. You can't give it just one day. It has to take its course and you have to kind of change the Titanic, you know, you have to start changing.
But I'll tell you, it doesn't take that long. It's literally 3 or 4 weeks. Now it's not one day, right? To your point, it's not one day, but it's not like 5 years either. You start seeing changes within a couple of weeks, 3 weeks.
I love that.
If you do it, and so what is Pete doing, right?
Yeah, telling.
So Pete loves his donuts, no matter what I tell him. You know, Tim Hortons and Pete are like this. He's probably got the frequent Tim Hortons card. I don't know if it's such a thing.
Just off camera, Partha says, what the bleep is that? I'll let you fill in that for a little bit.
See, because potty mouth can't be over
That's
here.
Right.
Yeah, I said, what the heck is that? What's going on with that? Come on. So Tim Hortons, French fries, TikTok, you know, and why do I mention TikTok? Because anybody who knows our methodology, you know, it's 5 pillars, and he really inundates his life with this stuff. And so it's difficult, and I empathize with them, but it's the same thing. Well, it's hard for me. It's difficult. It is difficult, but you're still coming to see me. You want procedures. You're taking medicines, and so we got to do something about it. It's action, and it's not just like one doctor telling me. So it's interesting, the research that's out there, especially with simple sugars, like our 4-year-old, the simple sugars. So why does it matter, right? So it matters because when you take simple sugars, there's a study in 2022 done on mice. And what they did was they fed mice a Western diet for 4 weeks. And what they found was that the mice developed what's called metabolic syndrome, where you can have diseases like coronary artery disease and heart disease and high blood pressure and diabetes. Their insulin, they were insulin resistant. Their insulin was not working well, and their blood sugars were high. And that was after 4 weeks. And so this whole syndrome where you have diseases that can kill you within 4 weeks of getting a Western diet, which is full of these simple sugars. So, and then they went further. They said, why is it that these mice are actually having problems when you give them simple sugars for 4 weeks? And what they found out was this, Kali, that the immune cells, we talked about this in previous episodes, and for those who didn't watch it or can't remember, that the gut lining has the most sophisticated immune system in the world. It's border patrol, par none. Nothing gets through, right? Unless it has to be, right? It only gets stuff into the bloodstream that's needed. Otherwise, you don't get in. So those immune cells, when you feed the Western diet to those mice, gets rid of the immune cells. So not only are your jacked up immune system, but guess what? You're also not processing lipids properly. So lipids are fats properly. So if those of you are following, that then converts into you having problems with cardiac disease and diabetes. Then they went one step further. They say, okay, what if we then take away all the sugars and just give fat? When they gave fat, a high fat diet, took off the sugars, immune cells came back in these mice, in the walls of the gut wall of these mice. And so what does that show? That it's actually the simple sugars and not more. Then they said, okay, is it that no matter what my microbiome is, if you avoid the simple sugars, are you going to have those same problems? So then they took away what they felt was a beneficial bacteria. Guess what happened? No immune cells again. So this is what happens. So, and why I'm mentioning that is because now you have diets, right? People say, well, if you want to lose weight, you've got to avoid all sugar. Right. Like, there's sugars that you basically eat a pound of bacon every day. Yeah. And then, you avoid every single sugar.
No glucose spikes.
Correct.
It's all about glucose spikes.
Right. And so what they found back to the study is that when you take away the beneficial bacteria and you take away the sugar, no effect. Immune cells are gone again. So what does that mean? So it means you need a combination of beneficial bacteria, the microbiome, as well as a diet that is full of fruits and veggies and good fats and good carbohydrates. So it's not just as simple as you take away the carbs, sugar. You'll be good, or you add the bacteria, you'll be good. It's a combination. It's a complex interaction between your immune system, your diet, and the good bacteria. So this is why it's the 5-pillar system is so important, that when you're really following that, you can actually affect all those.
Because they're taking away the simple sugars, but not things like positive sugars like bananas and fruit.
Right. And what they're doing is simply like, you've heard of like the Atkins or the diets where there's no carbs. It's all they're doing is they're basically simulating that and saying, if I just give good fats, right? Bacon, they call it a fat. It's not a good fat, but they're giving fats and protein. And is that going to do it? And it does if you have the right bacteria. But if you don't, it doesn't work. So it's not as simple as people say, well, I want to lose weight and I should do this. If you do it, you are really not getting the effects of a good gut. And so you're still continuing that disease, that diseased gut. And the disease continues, and it can manifest in, like my patient Pete. But then as we talk about in this podcast, it can also manifest you having brain fog. You can manifest you having neuroinflammation.
They're always talking about stress. Our social media is bombarded with the stress and the cortisol, and the young people are constantly talking about stress and anxiety.
And I know you're a big advocate for that because you've talked about young people and how you feel like, and you've talked about this, that you feel like that not just their diet, but everything around them is really helping them to have poor mental health, right?
And I just feel like they're very aware of it right now, and they're talking about their depression, anxiety, and stress, but they're not doing the right things. But I do feel like young people are starting to wake up because they are following us. They're following you on TikTok. They are, nice. And they're listening to you. And I feel like they're not quite connecting A to C. You know what I mean? They're not taking the actions yet.
They are, but I'll tell you, think about when you were their age and when I was their age, it just seems like they are going through way more than we did. So, and the biggest one is social, right? The biggest one is social and looking at social and these stresses that causes.
Parents fixing everything for them as well.
I also think that. I also think that, you have a lot of, it seems more than before. We were talking about, as we're getting ready for this episode, about cars, right? That some of our parents made us buy cars, right? My parents, I had to buy a car. Yeah. You couldn't now, here you go, dear. Here's your Jeep, fully loaded. Mm-hmm. And just make sure you bring it back in one piece. I'm like,
here's gas money.
It's very different, right? Mm-hmm. And how is that related to gut health? It's because we don't give them enough stress, enough of a challenge to be able to meet the needs. And the same thing happens with gut health. We now know with research that if you give the gut microbiome enough of a stressor, it actually now shows that your gut is resilient to insult. So when something happens, the gut is now able to withstand it. So for example, an infection. You come in, you get an infection, you eat the wrong thing, you went to a different country, eat the wrong thing. When you have tested the microbiome a little bit, give it a little bit of a stressor, then what happens is that they're able to withstand it. So the idea is that...
It's so fascinating to me because I can see how you can train your brain. Like you give your kids stress, you don't fix everything for them. There's a whole other podcast we have on that. My God, yes. People, we're like raising adults here. We're not raising children. But anyway, I did not know that makes a change of your gut. It does, makes them resilient.
And so when you have an infection, perhaps you don't have, so there's a syndrome that I haven't probably talked to you about, but there's a syndrome it's called post-infectious irritable bowel syndrome. So you get an infection and then after that, months and months, sometimes years of having diarrhea, abdominal bloating. If you train your gut the right way and also give it healthy stuff almost all the time, you can really withstand that. So I think that we are not giving our kids enough of a challenge to be able to, hey, let's see what you do on your own. Let's give you a little bit with some guidance, right, to be able to have those stressors.
Well, the other day, one of our sons, I won't call names, did something not super nice to the other son.
That never happens in our household.
We gave him an earful. And then a minute later, maybe 5 minutes later, I was like, well, I know you didn't really mean it. And it's okay. Because, of course, he was sulking and pouting in the corner because he'd gotten in trouble. And he said, you said to me, don't fix it for him. He was wrong. And he has to know that he was wrong. And it's got to be a little painful.
And you have to feel it. And you have to feel it when you are doing something wrong. Because I think more often than not, we feel bad. And we say, oh, it's okay. It's not okay because you can't do it again. But in the gut, I think, in addition, right, there's this whole balance. If you have too much stress, we now know that the composition of your microbiome changes. Why? And we've talked about this in previous episodes. When you have unabated, unbalanced stress, what happens? Cortisol is produced. Why? Because your body's getting ready for battle. It's getting ready to hunt. And so it thinks that that's happening. So because of that, it produces cortisol and other stress hormones and stress mediators. And so that stress increases the inflammation and that produces a certain type of bacteria and an organism. And I suffer from something called, sleep deprivation. Because
that's really the only thing that
I try though.
You don't get an A.
I'm getting better. Yes, I know. I'm like a B plus, probably, maybe less. But when you have sleep deprivation, this is something I struggle with because there's always something more I should be doing. It seems like. But let's say, notwithstanding that, when you have sleep deprivation, you're getting the same changes that stress brings on, and it's almost the same changes that you're seeing if you eat that donut. So it's critical. It's critical to be able to talk about getting adequate sleep.
One of my biggest jobs in life is trying to get you more rest.
I know. I appreciate that. But it's something that I'm working on. It's real life, right? All of you struggle with something, right?
Yeah.
And this is something that I struggle with because of the fact that I feel like if I could just get one more thing done. I'm getting better though. I think I'm going to try to get at least 6 hours. That's my goal. I'd like to get 7, but at least 6. And it makes a difference for multiple things, but for the gut, it's now evidence is showing that you can change your microbiome, and studies of longevity are showing that sleep is one of the biggest factors. Because when you sleep, right, to me, sleep is brain food, but it's also gut food because the gut can repair itself. Not just the microbiome, but the cells within the gut can actually repair itself. So somebody like Pete, who doesn't get a lot of sleep, what happens with, and this is not to bash social, but especially TikTok, it is down the rabbit hole.
Once really you start it, oh my gosh, you pull a thread.
Especially, it's like an hour later. It literally is an hour later.
Hour goes.
And I tell my patients not even to start, because once you start, it's difficult. So that affects your sleep and it affects your quality of your gut. I think that's what's important. But we do this.
We're like, oh, Simone Biles, how tall is she? Or like, how high
did she jump?
How many golds does she won? And then all of a sudden you're like down this. And that's not always negative content. I mean, we're following like amazing athletes there, but it's the time suck.
Well, it's difficult to get sleep when you have that because your brain's stimulated and it's thinking it's active, its dopamine receptors are activated. So it doesn't feel like it's time to rest. We talked about this at a different episode. We said, well, when you sit down to eat, your body's like, I'm ready to eat now, and I don't want to eat some other time. But if you're right before going to sleep, if you're activating your entire system, it's ready to go. Yeah. And now you tell it, okay, it's time to stop. It's not a robot. When this is not
and I have to admit, after such a busy day, the only time I really scroll is at night. Like late at night. I'm like, let me just, I know I need to do better.
I know. And we both, and
but
so
I admitted that so that listeners don't feel so alone. Because I am like literally, it's the only time I have to like catch up on my
100%.
News.
100%. But it
my gossip news.
but it's so fundamentally important for so many things, but we're talking about gut health. It really hampers it. So I think that's important.
Yeah, I'll work on it. You work on sleep. I'll work on night scrolling.
Yeah. And other things we can do. Right? We talked about sleep and stress. I think community is super important. I think, we've seen studies, like there's a study it's called the Rosetto study out of Pennsylvania. And we talked about how communities can decrease the stress. So the story about the Rosetto, and about this, Rosetto, Pennsylvania, we've talked about it, a community in the 1950s that nobody's getting heart attacks. People are living until their 80s and 90s with really no medical problems, it seems like. And so the researchers went there and found, hey, what's going on? And the only factor that was different is community. And what community does, it does the same thing that I talked about with spirituality. It reduces the cortisol and the stress. When you have people supporting you in what you're doing, that really makes a difference.
I was going to ask, is it kind of an Amish community? I can't remember.
I think it was an Italian community.
Okay.
It was an Italian community. They would, for example, they're coming home from work. Hey, I want to make up a name. Hey, Salvatore,
Eddie.
How you doing? What's the matter? And then, they're like, hey, no, let's go eat. You were just going to say,
what's the matter for you?
No, it's just like, that's not a good greeting when you're going at night. So it's like, let's you make a pasta. Let's go make pasta. They're like making pasta and whatever. And they ate together. But how it correlates to what we're talking about is that it gives the same amount, again, going back to the 5 pillars, it gives the same amount of protection in your gut health as eating, great food and making sure you're getting complex carbohydrates. That's how important it is. So people say, well, how come all these things are happening and I'm still like, I'm eating well, but I'm not getting better? And I tell them, listen, tell me about the rest of your life. And invariably, there's all kinds of stress. And in Western culture, we feel independence is like the best thing ever, right? I mean, we crave people to be by themselves, doing things together. But the problem is that during all courses of humanity, during our times that we've succeeded, we've done it together with folks. So there's a lot of people that are alone and have no real support system. That's a huge problem. And a lot of my patients that are doing this don't have a support system that they can go to. And that's a huge part of this problem.
coming from a Caucasian upbringing in a small town of 10,000 people, I understand in a deeper way what you mean about more isolated culture. I mean, we were family oriented. Of course, we saw each other, at all our family events. We have a big family, big Thanksgivings, all of that. But I never really understood what you meant until I was married into a culture outside of the Western culture. And it's the only thing I can describe it as is you kind of just don't know unless you know. And I want people to take a look around at restaurants and at grocery stores and seeing folks from different nationalities shopping together, from little children all the way to grandma and grandpa, and older grandma and grandpa, great grandma and grandpas. So they're shopping together. It's major community and tribe mentality with that, and you don't see it. So just pay attention next time you're at Costco. You're going to see the generational non-Caucasian families shopping together.
Well, I think I'm a ringer again. It's like, I remember I talked about it before. I'm the ringer. I'm the guy who's the professional, whatever, soccer player in your meeting or whatever it is, baseball game. I think it's because I've got the best of both worlds. I came to this amazing country at an early age, but I've got the immigrant mentality. And I think that's what you're talking about. Immigrants, because the fact that, due to necessity, almost, people stay together and support together and really, really, really spend a lot of time. And that builds a lot of resilience. And I think that we're losing that because the fact of the fierce idea of independence. I mean, it doesn't mean that you can't be independent, but the support system is what you're talking about. And that's very important. And I think that there are Caucasian families, right? There are Caucasian families that are immigrant as well that still embody that. And I think that, but it's just the idea that when you're coming from a culture that this is a necessity where you're supporting each other, you bring that same idea, when you immigrate. And I think that's what we did. And it really helped us. When my dad was ill, we just got together and we said, that's what's going to happen. And you did the same thing. I mean, you were an integral part of our support with my dad. So I think it's an important point. And the concept is that what's the takeaway point is that if you can try to get community support, if it means that you're in Portland, Oregon, and your family's in Ohio, you can find a work family. You can find a hobby or support. But you can also go online. There's so many online communities that support each other. You've been bashing social media, but it affords you the opportunity to be with a community that's not next to each other. And because of the pandemic, now we've got so many virtual things that are going on. So if you feel like you're out there listening or watching, get a community that can support you. And I think it's important.
In our family, we really try to live by these 5 pillars. How do they help maintaining a healthy gut?
Yeah, I think that we talked about a little bit about this, about community and I think spirituality, but movement is pretty important. I'd like to talk about that a little bit because it doesn't seem intuitive how moving and exercising can really help your gut. And I think that what it does is, first of all, the colon and the intestine are muscular organs. When you're moving, it also helps to motility or increased movement because the body is moving and it's getting more blood flow and the entire organ is moving. When it does that, that helps to clear out sometimes the toxins that are there, and helps to be able to get a microbiome that's healthier. In addition, it's something that I think we mentioned before, where when you have blood flow coming, you have energy that's optimal for the right microbiome. If you have that, then you can optimize your gut health. So movement is so important. Something like Pete. I'll go back to Pete, and he's poor Pete, because I've been talking about him the whole time. Pete is someone I cannot convince to be able to move with purpose, and no matter what I do, and there's a lot of you out there, you kind of know what to do, right? But sometimes you don't know why.
Doing.
Well, also doing and why you're doing it. You're doing it because this area of your body, which is your gut health, can really then lead to havoc elsewhere. Things like brain fog can be improved if you just do something like moving. And it doesn't mean that you have to get a gym membership, right? It just means that you have to do things that you don't do now, which is maybe just take a little bit more time with your kids or walk your dog instead of trying to be able to just get time to just watch television or do something that's completely inactive. And I think that in addition to community, in addition to spirituality, in addition to nutrition, and I think having movement, especially purposeful movement, is really critical.
I like that we can make small changes in, our daily habits. When we make consistent changes and that they're doable, it really can make a difference. So can you give us one tip? What is one tip that we can optimize our life today through improving gut health?
I think what would be great, especially I've tried this with Pete and other patients, is that try to give them at least one fermented food they could add in their diet and try to do it with each meal, right? So we're talking about anything that you have, like yogurt, like sauerkraut, like kefir, any of these foods, it can really make a huge difference. And if you put it with each meal, you can really optimize your gut microbiome. So if you have an unfavorable gut microbiome, and now they have tests to be able to find out. So not only do you not have to guess about it and say, oh, I have no symptoms, I wonder if my gut microbiome is okay. You can get some tests that are out there, and you could ask your doctor, if you're watching, what the tests are, but you could actually now accurately find out what your microbiome is. And here's why it's great, because then, our kids eat broccoli. It may not be broccoli that you need. It may be that you need something else, right? You may need Brussels sprouts, you may need spinach.
Right.
And so it really helps you, because I think in general, we tell people, hey, in general, eat this and eat that, but now you can tailor make it, and you can make it more specific for the individual. What is good for you may not be good for me, and I think that's important because it helps us to be able to make changes in the lives. So I know,
I love that. It's totally doable. I mean, most people like yogurt. I mean, I love cottage cheese. I'd have it for lunch and dinner.
Would you think that having a test that tells you a little bit more specifically what to do, wouldn't that be much more helpful than these kind of general guidelines that people give?
Which one do you recommend or do you like?
Well, there's a bunch out there, right? We like Viome because we worked with Viome. And they also give some, you can use whatever you want. We know Viome, but there are at least 2 or 3 out there. And what it does, it makes it more specific to you. It makes it more personal. I think people like personalized healthcare. So to answer your question, I think if you do it and you do it consistently every day, it is going to make a difference in your life. So people who are suffering from Crohn's disease, ulcerative colitis, celiac disease, reflux, all of these are symptoms of to some degree, right? To something that's not right with your gut. And so if you can optimize your gut health, I think you can do wonders for those things.
I just think it's really important to have this conversation because I think people know what they eat matters, but I don't think that they knew about movement. I don't think they knew that how much stress affected your gut. I mean, I think they kind of did, but this movement piece is really interesting. So thanks for that. Is there anything else about dis-ease in the gut and gut health that we want to talk about today before we close?
Yeah, I think we should hit upon leaky gut. I think that leaky gut is really important. I think we've talked about it before, but for disease in the gut, you have these microscopic changes in the gut that you may not even be able to see that you can affect. That's the beginning of disease in the gut. So we've talked about changes, in your diet and all the changes in your pillars, but you can actually now, if you talk to your doctors, there are supplements that you can have that can actually repair the gut. So there's products that you can take that actually can repair damage. So I think it's a great time when you have disease of the gut, when you have inflammation of the gut, even on a microscopic level, you can talk to your doctor. And the other name for leaky gut is increased intestinal permeability, right? So when you have increased intestinal permeability, what can you do to be able to stop that? Besides, everything we've said will be helpful. Talking about changes in the diet that we talked about, spirituality, community, purpose-driven. I think that all of that helps, but if you can also let your doctor know, hey, I'm doing this, and this is what may be happening. Can we actually repair it? And I think that's important to talk about with disease. And it can, if you stop it now, it can prevent further damage, because as time goes on, we don't really know, right? We don't really, when people are asked, what causes ulcerative colitis, what causes Crohn's. We don't know, but we believe that this starts with small changes in the gut lining that then become larger that we can see. There's even a condition called microscopic colitis. So I may have talked to you about this. So I had a patient that had microscopic colitis. So that's when, your colon looks normal. This woman had a colonoscopy already and it looked fine, but she was suffering from really bad diarrhea multiple times in the evening. And she almost lost her marriage. Her husband was not supportive. And he said, I've had it. I can't deal with this. It's been months and months. So I saw her and she was at her wit's end. I was her last hope. She said, so I said, let me just see what's going on. And even though the colonoscopy was normal, I noticed they didn't do biopsies. I said, well, I think that it may be that there's some other condition that's not visible with the naked eye. So I did the colonoscopy and I found that she had microscopic colitis, and we treated her with medicine, and it was within 2 weeks she was better. She was having 1 or 2 bowel movements a day. And then I asked her to, start a pre and a probiotic, had a great bowel regimen and a dietary regimen. And thank goodness, I think it saved her marriage, and she's been doing well for years. And, even though I have some strong feelings about the fact that if someone gets ill, you don't bail, but that's me.
But I'm sure there was confounding issues about, her stress and her reaction to that.
I don't think so. I think he was just a jerk, Cal.
Yeah.
Sometimes some people are just el tulos. They're tools. That's Spanish for tool. El tulos. So the guy was just not a great guy.
Not a great guy.
He wasn't. Like, come on, she was a nice lady, and you may be right that maybe at home she was a demon.
There is in sickness and health, right?
Yeah, in sickness, especially when someone's suffering. It's like, and they're not doing anything to make it worse. Like they're not non-compliant, just going to doctors. So it was a little tough. But having said that, they're doing fine now, and and she's doing well. Yeah.
So what ended up happening with Pete? My gosh, he's a tough one, huh?
Yeah, well, I think that I've talked to Pete about these things, and Pete just does not want to do anything about it. He wants a magic potion, a magic bullet, a magic pill, a magic something. Okay, there's got to be something more. You got to do a procedure. And so, at some point, you have to do something yourself. There's only so much people can tell you and so many tips. So I'm hoping.
You kind of have to be in the driver's seat of your own health. You have to care and you have to want to do it. Correct. No one can do it for you.
Yeah. And there's some responsibility there, right? It's a two-way street and it's a partnership. So Pete, unfortunately, has been suffering from this, and I've told him about some of these things, and he still really does not want to, he thinks that there's something else that we can do which is magical.
But this is what I'm trying to say too, and I know you said this, is that people want the easy, quick pill, and it does take multiple. I mean, listen, we've been living this for 10 years, and even here on this podcast, I'm like, gosh, I should eat more kimchi. We should definitely be having that at every dinner. You know what I mean? Because we
do pretty well, though.
No, but we tend to eat cottage cheese, the things we like. It would be nice to mix it up.
But it's good though. It's fermented foods. You do well. I mean, he does. I don't think.
He's eating donuts.
I don't think
it's very different. But I
don't think there's a cottage cheese that's ever seen his plate.
I'm just saying it takes a lot of times to hear the message, and that's where you're saying doctors either won't take the time or don't have the time to continue to barrage and remind. Right. You have to be in the driver's seat.
And I see him, and I think we've made some changes, but still, I think I wish that we could have a better outcome with Pete. But I think Pete's unfortunately doing the things that you're not supposed to, and he's continuing to do it. But I'm hopeful maybe Pete will be listening.
That's right.
And hearing it, maybe it'll be enough.
We believe in you, Pete.
That's right.
Thanks for another fun-filled, packed episode.
Yes, and again, I should note that you've got a clean episode without you cursing, and making and embarrassing our podcast.
2 episodes in a row with no cursing.
That's exactly right. But next episode will be, I think we'll have a great guest, and we'll talk about strokes and what we can do about it, because this whole
Jonas is incredible. You guys are gonna love it.
Oh yeah, Jonas Koffler is our guest. But this whole podcast and his ideas of doing something about this came about because my dad had such a devastating stroke. So it'll be great to talk about what we can do to be able to reduce the risk of that.
Sounds exciting. Next episode will be amazing. Thanks for tuning in to Heal Your Gut, Save Your Brain.
That's exactly right. Thanks everyone for watching. And remember, take care of your gut and your gut will take care of you.
Make sure you never miss an episode by following on Apple Podcasts or subscribing wherever you listen.
And if you want to learn more, get a copy of my book, also titled Heal Your Gut, Save Your Brain, available everywhere books are sold, October 1st.